I have with me here on the platform Gabrielle Melin, who is a assistant professor in our department, and with her is Vicki Samike, who's one of our nurse practitioners, both of whom work in our emergency department, and so are sort of on the front lines of this dilemma of how to assess and evaluate and come up with effective dispositions for patients with serious and persistent mental illness. So we're going to have the two of them start.
Thank you, Jeff, and thank you for coming. And it's nice to be here and not have to worry about 45 below wind chill and wearing a down blanket for my jacket and all that. So we're glad you're here. Thank you. So I'm Gabrielle. This is Vicki, and again, we work in the emergency department, and we're going to move ahead and get things rolling here. So we do not have anything to disclose, and our objectives are the following. We want you to be able to describe 3 reasons why our patients fall through the cracks of the mental health system. Describe 1 intervention or system improvement that data shows has improved the mental health care of our patients, and name 2 reasons why psychiatric patients may have a prolonged length of stay in the emergency department. So the overview will include who are these patients that have chronic mental illness and why do they fall through the cracks. Factors that impact our patients and why they stay in the emergency department for a prolonged length include resources, disposition, drugs, their family not being involved, being elderly, having a lack of follow-up, a lack of medication providers, county resources, lack of resources throughout the spectrum of care, and a lack of psychiatric inpatient beds. Also, we'll discuss what the literature says about this. So serious and persistent mental illness, or SPMI, includes schizophrenia and other psychoses, diagnoses, treatment-resistant mood disorders, PTSD and other sequelae of trauma or adversity, substance use disorders, personality disorders, cognitive disorders that can be either developmental, acquired, or degenerative. Disadvantaged includes the homeless, the jobless, and people that are uninsured, those with troubled legal status, criminal, immigration, and guardianship, and of course, combinations of the above. What data do we have on these patients? What does the literature say? The Mental Health America website has data from 2018. We know that 12.2% or 5.3 million actually